my name's Kath Benson. I'm the health support worker for the learning disabilities team, and together with my colleagues Carol and other members of the nursing team, we support Margaret with her health needs, which means we escort her to appointments, making sure she understands the appointment, what's going to go on, and put any plans together for her care.
My name is Margaret Southworth, and I had bowel cancer, and I went to the doctors at the hospital with Kath and Carol.
So we found out you had cancer, and I took you, didn't I? And we had to have that test in the gastro unit.
That's right.
And you were there a couple of hours.
Yeah.
And then the doctor told you that you had cancer. Can you remember him telling you that?
Yeah, I can remember when he said I got cancer in the bowels and that.
And we talked about what type of operation that you could have and the treatment.
Yeah.
There was you involved, there was me and Carol and all our team, and we had like a multidisciplinary meeting, and we talked and explained everything to you, didn't we?
And the nurses
and the nurses there.
And the doctors as well. And I went in straight away, and I had my operation done, and they took it away from me to make sure it doesn't come back again. They fixed me stomach bag onto my stomach, on my tummy, and the nurse got a pen and she drew around it where it's going to be, and after that I went, it took it from there, and then that's it.
And you were up and about, weren't you, within a couple of days?
Up and down, yeah.
Margaret does herself an injustice because most recovery is quite lengthy for this surgery, but Margaret was up and about on the ward within a couple of days, weren't you?
Yeah, yeah.
And with the aftercare from our team and the stoma nurses, she was discharged home, weren't you?
That's right.
And then after you had the operation, that's when you went to have the chemotherapy, wasn't it? And what happened when you had the chemotherapy? That's when you felt quite poorly, didn't you?
Yeah. Yeah, they kept putting drops in me, and every time they did that, it went very tight, and I was nearly going to pass out. I kept going like that all the time, you know.
Yeah, I think Margaret had about, was it 9 sessions of chemotherapy, which is it was quite a complicated regime because there was quite a lot of medication to go with it, and we set up care plans and what have you, because Margaret does have support staff that do assist her, and also we put together plans for how they cared for her stoma and have it with the assistance from the community nursing team. So we used to take you for your chemo and that, didn't we? That went on for quite a while. What about some of the things that you had to do when you had the chemo? Can you remember some of the things you could do and couldn't do? Do you remember?
Well, number one, I wasn't allowed to lift anything like tea or coffee or shelf. They told me not to do that, and they told me not to bend down to get anything, because if I do it will hurt and that. So the doctor said take it easy and wait till it's passed over, and then you can do your jobs and that, your work. But I'm not to do so much, because I get very tired very quick, and that. Yeah, I'm done very well.
And we still go to see, do you remember we go and see Dr. Dimwater now every 6 months? Margaret was
6
having
months
scans,
I go.
and now he's reduced it, I think it's every 12 months, and she still goes back to see Mr. Lynn, who's the surgeon, and I think they're very, very pleased with your care and how well you are. Margaret, because she's got learning disabilities, most doctors do provide a learning disability health check, which we support Margaret through at her GP surgeries, where she'll see the nurse and then she'll go and see the doctor, who'll do a thorough examination just to basically identify any underlying health needs that she has. But I don't think you have any at the moment, have you? Quite well.
No.
But we're always at the end of a phone. Margaret rings us quite regularly, and we come and see you probably once a fortnight at least, don't we, just to see if everything's okay. We liaise with support staff and put plans together about her stoma care and what things that they should be looking for, and obviously we're always there if they need any help or advice around that or any other healthcare needs that she has.
Yeah. And then if I get any letters from the post, I've got to ring Kath or Carol to let them know if I got any appointments, like the doctors, and the dentist and all them.